Hey y'all, it's time once again to add to our greatest hits collection where we're replaying episodes from the previous 6 years that are just as relevant today. This was episode number 160 and it originally aired in May 2021. On this one, Jill McCormick was in the house to share some provocative thinking about solving what she refers to as digital health's passionate problems. When we use human-centered design and then tie that work to digital transformation, we start solving the problems that really need to be solved to move our business and healthcare forward. Let us know what you think about this one.
The flow.
Hey listeners, we are so pumped for this one. Zane and I are really excited to have this conversation with you this week. We've got Jill McCormick in the house with us. Jill is the Director of Design and Innovation for Baystate Health and their digital innovation arm, TechSpring. A lot of you have heard about them and are aware of the work they're doing. It's fascinating work. Jill, welcome. How are you doing today?
I'm doing awesome. Thanks for having me on, guys.
So good to have you, Jill.
We're hoping the weather's decent in your area of the country right now. Is that Western Massachusetts?
Western Mass, yes, it's gorgeous. My kids are actually at the farmer's market right now as we speak.
Oh, it's snowing here. It's snowing here in Detroit, and we're in sweaters.
Oh, no.
Yeah.
That's awesome. This is going to be a lot of fun. Jill, you and I have, we couldn't even put a finger on how exactly we first connected or got to know each other here. But the one thing that stuck out for me was there are a few words that whenever these words are kind of in the same sentence or in the same area, like my ears perk up and I'm always like, okay, somebody who's talking digital health, innovation, human-centered design, and the applications of it. I mean, you're in the thick of it. Tell us more about TechSpring itself. And one example you gave that I heard about recently was this Health Equity Innovation Lab, which is, again, another thing that just kind of blows my mind about the kind of amazing work you're doing. Tell us about that.
Sure. So we're Baystate Health Digital Innovation Hub, and we started about 6 years ago, and we really work to solve the passionate problems of the organization and match them with compelling digital solutions in the marketplace. And so how we do that, or our business model around that is that we actually work both with the health system to frame the passionate problems and actively work to solve them with the health system. But we also work as a product accelerator or product development accelerator services for technical or technology solutions.
I like that. I like how you just use the term passionate problems. I've not heard that before. I assume it's intentional.
Yes, it's intentional. And really what passionate problem means is that, is it aligned at the highest level of strategy for the organization? Is there momentum behind solving this challenge? Is the front line going to engage on solving this problem? Do, consumers want to solve this problem as well? Consumers being, obviously in healthcare, it's quite broad. It's consumers being patients that are prospective or your patients themselves, or even your staff and employees in a competitive market where it's hard to find and retain talent, thinking about employees as also consumer.
That part's really interesting. We recently had a guest on the program, Kelly Gill, who's an executive recruiter. And I think as part of the conversation, it just came up. He mentioned about how it's true. You can just throw a stone at a problem in healthcare that can be solved with digital. And we kind of chuckled about it during the episode, but that's actually stuck with me about the part of it's not a question of, I just wish we had other things to solve with digital transformation. It's the whole thing that you just mentioned of okay, what does the consumer actually want here? What's the thing that really does need to be solved? Not just from one stakeholder who swears this is going to revolutionize everything. I mean, it can be easy for us to kind of, recoil and just think, hey, you know what? We're boiling the ocean every day, and we're just not making any progress. So I just wanted to give some kudos there for the work that you're doing and truly making some progress in this area.
Yeah, and I think sort of the idea that around passionate problems that sort of sticks out to me is really just around, will you get it to be, so as entrepreneurs, as innovators, we are people who have a lot of activation energy, right? We can help with just fortitude alone, climb that hill, but that is maybe not the best use of your skill and resource. And so really what we try to do when we frame them up as passionate problems is move them from the edge of the table to, something that somebody actually is planning to solve this year. What's in their strategic goals? What is their aligned self-interest in solving that, so that you can tap into that as you're pushing it forward. So without the passion in the problem solving, I think that you're sort of, because there's so many challenges to address in healthcare, there's so many fires to put out, you're going to slide right off the side of the desk. And so you have to pick the right problems to solve.
That's
I like that. I like that framing. I think it's unique. I've not heard that before, and I might have to use it if that's okay, Jill.
Please do.
Because I feel like digital teams, innovation teams, you name it, have such issue where they invent something, they scope something, they visualize something, and they try to pass it off onto operations and it just sort of falls flat. And I think it's because we've not addressed, is this truly a passionate problem that someone on the inside, so to speak, really wants to solve?
Exactly. One of the challenges that we face, and this leads into your question around the CGI or the Clinton Global Initiative, is that it's really hard for health systems to work with startups. And at least it had been for us because, again, we're mostly self-funded, working with technology innovators who sort of pay for that product development acceleration services. We hadn't really been able to crack the nut in how to work with startups. And one of the ways that we overcame that challenge is with the Mass eHealth Institute created a sandbox program where they said, okay, where are these centers for where are living labs across the state of Massachusetts that have access to the people, the technology, and the process for the problems and challenges that startups want to solve? And how do you create that bridge so that they can, again, do their product development, validation work or pilots or whatever it is that they're going to do? There just wasn't like a business model or a way for us to engage. And so they created the Sandbox program. So that was really helpful and helped us think about how might we work with startups more? But why I sort of bring that up, though, is because we've sort of figured out, how to source the passionate problems from the organization, how to create sort of priority and arguably like challenges or propelling questions around them. We also have deep skills in the solution space, really thinking about what are the solutions are there in the market and sort of what is their differentiating factors, and then how might they actually connect and integrate through the system? How do you manage compliance for doing crazy new things inside the organization? That's a big governance and compliance and information security and, all of those sorts of things. Yeah. How do you structure relationships, et cetera? And so as part of that, we are expanding sort of the TechSpring brand in a way to sort of say, okay, well, where are other areas that this kind of model could work? And so through that relationship with Mass eHealth Institute, we were introduced to my alma mater, which is Babson, which is amazing. And this amazing doctor named Claire Pierre, who is the chief medical officer for Harbor Health. I think she has 7 community health centers that are like the federally qualified community health centers. And what the things that she noticed in her passionate problem that she's looking to solve is that there isn't a lot of funding and time investment in solving challenges for healthcare, for population health and for community health center groups. And said, so how can we leverage sort of what we've found from TechSpring and our sort of model, Babson's amazingness with entrepreneurship and startups, and then using the community health centers as a living lab to solve the challenges with sort of a racial and health equity lens. And so we're super excited about that commitment to work with them on that. We work with Public Health Institute of Western Mass, for example, solving some challenges with them, sort of building off of that momentum of how do you convene, how do you figure out what the problems are, and how do you bring in the right technology solutions and then support their collaboration.
That's fantastic. Well, it sounds like you guys are up to some amazing work over there and spread out further than I thought you were across different stakeholders. So that's great. And I loved your nod to more community help, especially being the Canadian on this podcast. In Canada, our health systems are much more community oriented. So when I came to the US, I had some questions about where we're making investments. So very, very cool. So thank you again for being here. But today we really wanted to talk about sort of like where are things going in healthcare when it comes to innovation, human-centered design, what is current state and how they're being applied and so on and so forth.
Human-centered design is really just the magic of placing the user or the consumer at the center of the change management process. And so you do this by establishing sort of a deep empathy with your consumer, your customer, your staff, whatever it is, through things like empathetic interviewing and observation. And you start to put that into a way of understanding it so that you are actually analyzing your clinical and business problems from your consumer's perspective. So that's a different way of looking at it, right? Typically, we solve problems from our perspective if we're the business. And so this is actually looking at what are the problems and how might you solve them from from the patient's perspective, for example. And then what you do is you actually co-create the ideas for how to solve these problems with your consumers and involve them in the prototyping and testing of the solution. And so to me, it's sort of an amazing way to delight your consumers and really reshape the way that your organization solves problems in general. So state of sort of what is the status quo?
Yeah, what's the status quo?
Can I give an example rather than
Please.
answering that directly?
Absolutely, please.
So the status quo is really, in my mind, just this tremendous lack of empathy in general in the design of our healthcare system. So that's pretty broad and harsh, right?
Yes.
And maybe arguably one layer below that is maybe a lack of cross silo coordination for shared goals for the user. So it's really not really understanding what it is that we put patients through, if you will, when they engage with our system, and how to solve problems from that position. And so the example I'm going to give, so first of all, you need to know a little bit about me. I have an immediate family of 7 individuals. Wow. And because I happen to work in healthcare, I am Dr. McCormick. I am not medically trained. I don't have any clinical background, but because I'm this director of innovation or whatever the heck I am, I'm this point person for my extended family and often for my friends. So I'm perceived to know something about how to navigate. They always call me, not just for Bay State, like my immediate market, but nationally, I have people calling me for help.
Right. Do you have a social work degree? I think that
I do not, but I'm actually thinking about that, to be honest. Yes. But my story is for my 3-year-old daughter. So my husband and I are finally out to dinner 2 years, first time in 2 years we've been alone together. We're going to go out to dinner and we have a night in the hotel. And my stepdaughter calls me to tell me that my 3-year-old daughter seems to have broken her thumb. So what do? Get some information. And then I immediately call without looking online or searching the web. I'm going to call, my pediatrician's office and explain to her that whoever answers the phone that my daughter seems to have broken their thumb and what do I need to do? And so put the phone down, get a phone call number 2 back from the pediatrician's office, and the nurse that's on call tells me, yep, this is not an emergency. She's not in any pain. She doesn't have any of the other symptoms. Don't worry about it. Call in the morning to be seen by a pediatrician. So they wow me with phone call number 3 because it's 7:45 and I haven't even started my day. And I get a phone call from my pediatrician's office and they're like, come on in today and have an urgent visit. And I'm sort of like, well, she's not in any pain and I'm kind of away. Is there any way in America that I can put this off until another day? And she's like, yep, it certainly can wait until tomorrow and get an appointment for Easter Sunday. So on Sunday. So I take my daughter in and I meet with the pediatrician and she says, well, I don't really know what to do about a broken thumb. So here's an order for an x-ray, but I actually recommend that you go to urgent care that has at an ortho clinic because you'll get an x-ray and a consult from your ortho person. And that would be super, super great. It would save you a trip because otherwise they would take an x-ray, they'd send it back to me, and then I would refer you to ortho. That's how it would work. It's too many steps. And I said, wow, aren't you savvy? Thank you for that. So the next day, Monday, I go to the appointment and I accidentally go to the wrong facility. So I get my 3-year-old out of the car, hobble up some stairs and realize I'm at the wrong facility. So visit 3. So I've now been to the pediatrician's office, the wrong facility. Now I'm at the right place. And they have a sign outside that says, please call before you commit. So I call and she says, you know what? We can't see your daughter here. And I'm like, excuse me, what is it that you do again? And she explains what she does. And she describes exactly what I need. They take imaging of things and you get a consult from an ortho. And I'm just like, oh, that sounds like exactly what I need.
Absolutely.
Are you sure you can't see me there? And she's like, hold on. So she runs and goes and talks to the doctor. She comes back and says, nope, we can't see you here. And I'm like, excuse me, what is it that you do here again? And she says, she tells me exactly what they do, which is exactly what my daughter needs. And I said, I don't think I'm articulating myself correctly because I think you do exactly what I need.
Right.
And so I'm continuing to push. Long story long, I end up talking to the manager. Turns out that they have a hand specialist who's out on maternity leave. And so they can't see me there because they don't have it. And they were saying, well, why don't you go to the emergency department? And I was like, well, because I think that they're just going to take an x-ray and then they're going to send it to my pediatrician. And then I'm going to get a consult from ortho. So like, couldn't you just take my x-ray since I'm here for my daughter instead of me going to the emergency room and waiting and going through all of that? And she's like, no, we can't do that. And so I'm like, exacerbated, like what the heck, right? And so I was like, if it was your daughter, you had a 3-year-old and you're like, and she's losing her mind in the back seat, what would you do? And she's like, oh, I would call this other urgent care place that does this. I was like, okay, wow. And so my point here is that, so then eventually, I made it to the place that I needed to be. My daughter had both the x-ray and the surgical consult, and she's getting a surgery sometime in the near future. She didn't break her thumb. She has trigger thumb. She's fine. So, I got what I needed eventually. But the part that was sort of hilarious and that I was talking about with my husband is that because of my role in the family and why people call me to navigate is because he calls it these shower ahas. He's like, what I love about you is that you have the capacity to ask the things that I would have thought I should have asked when I'm in the shower. You ask them now. And so you drove toward that. And he's like, can you imagine if I came home and said, we have to go to the emergency room because this place can't take Luna? And I would have said, you're out of your mind. And I would have read the website and said, they absolutely do this. And I would have actually not trusted him that he was in the right place. And so I know that's a long story, but it's something to just sort of talks about how it just wasn't designed for care navigation because of this silo optimization. The person who answers the phone from each of these places, they just do what what their silo tells them to do, right?
Sure.
Rather than optimize around what is my true journey. I shouldn't even have gone to the pediatrician's office.
Sure.
They probably should have trusted the mom from the first phone call that her daughter's thumb was out of place and immediately given that sort of care of navigation.
Yeah, first and foremost, we did not hear a whole lot of empathy from any part of the healthcare system that you just encountered. And that was the first thing that stuck out. Yeah, not a whole lot of, even based on what you just said, your repeated attempts to just have them have a morsel of empathy for what was happening and to make even one part of this journey easier. I think sometimes I trip people up when I use the term digital transformation all the time, because that sounds like the gigantic big thing. You're trying to boil the ocean. And what it really does come down to is single encounters with a single patient, caregiver, family member, like what you're just describing. And I'm trying to think now of, like how we could use human-centered design principles and digital solutions to have solved even a couple of the parts of that, to remove some friction there, bring in some empathy to that journey.
What I really appreciate too, what you brought out, Jill, or the example you brought out, is where when you reframed sort of what would you do if you were in my position or the mother, then all of a sudden you got an incredibly different response from the nurse. I thought that was interesting. And I think it perfectly highlights sort of this lack of empathy and the lack of thinking in the system.
It's so true. And that was the trigger. Like that was basically, I forced empathy on her, right? Like put yourself in my shoes. What would you do? Knowing all that you know. Anyways, so going back to your question about how that relates to digital transformation. And I think the answer to that, Jared, is just, it's really around, we need to understand what our patient journeys are. So that's where the human-centered design piece comes in. So what I just gave you was an example about care navigation. That's the consumer journey for navigating care. And so some may say that one strategy underneath like a consumer strategy might be to create frictionless journeys for your patients, right? And so that leads to loyalty and has all kinds of potential benefits around why is it that you want to make it very easy for patients to engage with you. I think I don't need to probably get into those reasons. I think we can fairly understand it. We want to make it as easy as possible for patients to get into that journey. And so in my journey, like there could have been touches to the website. There were certainly call center experiences. I might have used the patient portal. There was a PCP office. There was a navigation component, like an actual navigation where I was, using a Google search term that was incorrect, et cetera. That sort of all happened along my journey. And so traditionally what we see in healthcare is that nobody is sort of looking across all those silos, like I said, call center, patient portal, website, PCP office, et cetera, to solve a patient's issue or even looking at that journey. And so in many organizations, they might have data or search terms about what are people searching for, that what are people trying to find out when they're navigating their care? What are people calling you for? Like, what are people calling you for? Like, listen in on a few calls to your call center to find out how are they navigating. The other piece is that some folks may have something as attractive as a CRM, for example. So they might be able to see an actual journey where a patient went to the portal first, then they called in, and then what did they do? And so my question would be, how did they get their needs met? Right. Like when you have, if somebody called in, like, where's the closing of the loop? What's that rest of that story? That whole long, boring story that I just shared with you is very interesting and filled with areas of opportunity. And so the question is as an organization, you want to get very curious about that and start to think about what are the problems that you want to solve that are important to the business, and what are the problems underneath those problems that are high priority for your users or high priority for your consumers.
I like that. As you've been working with Baystate and the team there, if I read your background correctly, this is sort of like your first opportunity in a formal health system. I know you've been in tangential spaces in health. What were like some of the most interesting things or insights that you were able to gather right away about how those teams are working, how the business is operating, and what did you do? Like, how did you jump in there and start teaching everyone about human-centered design?
It started with humility. This is hilarious. Okay. So when I first started working, I was insulted by my boss because before I even worked with him, because he said, you don't have healthcare experience. And I said, I do have healthcare experience because I was developing point of care analyzers for diagnostics. And so I felt like I had at least some level of healthcare understanding, selling into health systems, et cetera. I also worked at the National Institute of Health over in London for a while, working on their polyclinic model. And I was like totally insulted that he said that.
It happens.
And I was, it just does, right? Like whatever. For some reason, it ruffled my feathers. So then I go into the emergency department. We were looking at patient flow analytics and sort of ways that we could improve the patient journey inside the emergency department using like passive location awareness kind of things. And so my first step was meeting with the chief there, and he was just giving me a tour of the emergency department. And it was my first time behind this curtain of what an emergency department looked like. And he was showing me the board of like all the status board that had all like flight control of everything that was going on and how he managed his business inside the emergency room. And it was funny because the board is placed so everybody can see it. And I noticed that everybody was doing a dance that I didn't understand. He kept grabbing my arm in all different directions and like dancing me away from being in the way. And I kept sort of like eyes bugging out of my head and sort of like looking at all the workflows and just was like from a designer, which is what I am, perspective, being in there, I just realized there were so many problems and challenges that maybe needed to be solved, but that they all were dancing and it was working quite well. And I was an intruder. And then I had this further hypothesis when I was there. It was sort of like an epiphany moment for me that tech is an intruder. Because here I was like, here with my little tech and my adorable Mac computer and my Apple Watch and whatever I was doing, just sort of like in the way of all of these people doing business. And I thought to myself, whatever I do, I just cannot make it worse. I cannot be in the way, and that I needed to understand the dance before I tried to innovate.
I like that. Understand the dance before you try to innovate. I feel like, at least in my experience, especially since I'm on the selling into side of a phone call from vendors and LinkedIn inquiries, what I've noticed is a lot of startups or heck, even MarTech type vendors do not actually understand our business. And sometimes their tools and solutions get in the way. So keeping that in mind and going back to some of your experience working with startups, do you find that that's true? And how have you managed that? How have you worked with startups to position them better to be able to sell into an organization or match their solution to actual value inside the organization?
So we first start with conversations. So I don't ever pilot a solution without some level of a connection that needs to happen. And so usually that's a value proposition conversation. So I use human-centered design, if you will. I didn't know it was called human-centered design, by the way, when I was first doing this for other jobs that I had.
Me neither.
But that's what I was doing, is sort of really understanding, product market fit and sort of helping them understand what is the importance of the problem that you're trying to solve and the scope of all the problems that could be worth solving. What is how appealing is your solution? And really, can they see themselves using it? What would it need to take to use it? All of those sorts of questions around sort of that value proposition and is it a fit for us? And to me, that is the first place. They always kick and scream. They feel like they know that sort of stuff already, and they want to dive right into scoping a pilot or what is it that we want to do together. But I find that they often have strong understandings or strong lessons from that work. What else happens, though, which is also magic, is that you create a moment of tech inspiration on the clinical champion and the business owner side. And so when that magic happens, when the startup who, just like me, who thought I understood emergency departments, gets a dose of humility, right? Sure. That there's magic that happens there because they're like, oh, there's a lot to learn here. Mm-hmm. And then the organization or whoever the representative from the organization has a spark of, wow, the art of the possible. Mm-hmm. They all of a sudden want to work together in many cases, or in some cases. And really it's about facilitating that engagement so that they can best collaborate. And how we do that is we frame it as a learning opportunity. So we basically say, what is it that you want to learn from this experience, rather than the startup is thinking, if this pilot results in a commercial sale, then we have won. This has been a worthwhile opportunity. And they have tons of pressure from their investors and stuff. I don't want to minimize that, but that's why we really focus on how do you break this down to the smallest component so that a lesson can be learned, and then you can make a decision about whether you expand and further invest on both sides to go forward. So we frame them as learning engagements.
Love that. I love that. Very quickly, could you, maybe I'll take a step back. So, something that I always harp on in this podcast is the importance of culture of an organization around innovation. Talk to me a little bit about maybe some cultural barriers you had to jump through doing this work with Baystate, or, even with your startups. How do you think about that as it relates to human-centered design and actually doing the work?
That's a good question. So I think, obviously culture is a big piece of it. And on so many levels, I'm not even sure where to start tackling that. But the first piece that comes to mind around human-centered design, especially in healthcare, is you have to create proof points. You have to create, why is this valuable for me to continue listening? And so the real piece is about finding ways to demonstrate the benefits. And for human-centered design, it's really about how do you show, so less than sort of what you actually did, because oftentimes the example might be, and 10% of our population did this, and they don't understand that in a digital world, 10% might be amazing, right? Rather than jumping right to the sort of ROI, highlighting the benefits of the problem analysis and the problem solving aspect of it, to me, has been the biggest piece of that. The other piece that I think has helped shift the culture, and this is going to sound anti-innovation in some ways, but it's again around this governance structure. I think it's really important about lining up the projects that you work up on with the strategic imperatives and having somebody who understands what the technical feasibility is of anything that you're thinking about implementing and what that roadmap might look like. Absolutely. That's sort of the missing piece. And so really setting expectations around, this is what we're going to learn together. This is what it's going to inform in terms of investment or scale up or whatever, and that there's future decisions to be made. It's almost like in entrepreneurship, how there's like friends and family money and Series A and Series B and sort of things. You don't invest in everything all at once. And so helping folks understand the value of experimentation, learning lessons, and making decisions from that point has been the biggest challenge to sort of change the culture in that way, but also, I think, really seeing positive traction in that direction.
Love it.
Yeah, from Jill. And for what it's worth, Jill, I think it was probably a little tongue in cheek. I don't think it doesn't feel like feasibility constraints are anti-innovation, to your point, that's actually the world that we have to live in to make this applicable at all. So no, I'm glad you brought that up. as we start to kind of wind this down, Jill, I'm wondering if it's any of these pieces that you just spoke to, whether it's culture or operationally or the innovation itself, or it's some other direction, in terms of a call to action of maybe a low-hanging fruit or a first step that leaders can take in this direction to really help improve and make this connection with human-centered design in the things they're doing.
To a hammer, everything is a nail. And I think, Zane, I've either heard you say on this podcast or another time, just, it really, when is human-centered design the appropriate tool to use? And so it's not always the appropriate tool to use. You might already know what the solution is, a direction. You're already willing to place a bet. You have a vendor lined up. You're just ready to go. Let's go. You can use some components of human-centered design along that way. It's a very extensive tool set. Like maybe you'll use that in your experimentation. You might add some empathetic interviewing, or might do something in the human-centered design toolbook or playbook to address it. But really the challenges that need to be solved are anytime motivations, feelings, behaviors are relevant in that, and that you're open to new ideas. You're open to see what will come, right? If you have a senior leader who says, I want you to deploy X, Y, and Z,
right?
And they already think they know what it is and they've identified where they want to go, then you're just going to be in the way of them getting that done. So to me, what I see is that getting more and more projects where I have the opportunity to use the methodology, and then I use the methodology to actually go to the value huddles, go to the learning health systems rounds, going to steering committee meetings and things like that, to actually present the how things were done and not just what was done, has been a great way to gain traction. So if I'm thinking about that, I would say a critical step that leaders could take would be to find yourself an experienced designer and put them in on a project where you're open to see where it goes, and that you are willing to sort of invest in small pieces and allow them to be basically a self-actualizing team, right? Or a self-maximizing team anyway. And that you're willing to sort of let go, see what happens. And I think what you'll see is that if you're educating the rest of the organization on the methodology, if you're sharing in the idea that when we learn things, we're learning as an organization, and that's good too, that you eventually will live into a future where somebody is going to ask every time you're on a project, hey, who's the experienced designer on this project? To me, that's the future that I want to see, is whenever there's a project that sort of fits that criteria, that somebody is asking, not who's the champion, not who's the sponsor, but who's the experienced designer, or who is the champion, who is the sponsor, and who is the experienced designer.
I love that. I love that. I think and I realize we're getting to the end of our time here, but everything that you shared is so rich to me, because I feel like, healthcare is undergoing a massive pivot now where we don't really even know, at least traditional healthcare doesn't even really know where it should be. And the only way we're going to start to frame up what that looks like is to go deep into insights in collaboration with our patients, health plan members, you name it. And in my view, it's human-centered design, qualitative research, all this stuff is the methodology we're going to need to use to drive us there.
I couldn't agree more. And I just sort of add even more like kumbaya thought around that is that, I honestly believe that you can apply this to structures and societies and relationships and things like that, and really create a beautiful world that's based in empathy, that's designed for a beautiful world.
I love it. Jill, thank you so much for being here. We so appreciate it.
Thanks for having me. It's been awesome.
Yeah, Jill, where do listeners, where can they connect with you if they want to reach you? Is it on LinkedIn or Twitter? What's the best place for people to find you?
LinkedIn is a great place to start, and also techspringhealth.org. And there's hello@techspringhealth.org general mailbox that makes its way to me eventually.
Perfect.
But LinkedIn is a great place.
Okay, good. Perfect. Jill, thanks so much for giving us a few minutes and giving us a ton to think about. We're so excited for this. And again, this is a ton to give us some direction and inspire us and all the things we're doing. To you, I say stay safe, be well, and all the best on everything you have going on.
Thank you so much. Cheers.
All right, thanks to Jill and Zane, and thank you for listening. We hope you found some value in this conversation, and if you did, please, this is so important, please subscribe and tell your friends and colleagues about this podcast. Healthcare Rap is a member of the Shift.Health Content Network. If you enjoyed this podcast, you're going to love the other shows on the Shift.Health Content Network. We have 28 of them, folks. Go check them out at Shift.Health. They're all free and available on demand. Until next time, keep marketing forward. Thanks, and that's a wrap.